The circulatory system is a network of organs and vessels responsible for transporting blood, oxygen, nutrients, and hormones throughout the body. It consists of the heart, blood vessels, arteries, veins, and capillaries, and blood. Its main functions include supplying oxygen and nutrients to tissues, removing waste products, regulating body temperature, and supporting immune responses. (21) Which of the following is the primary organ responsible for pumping blood throughout the body? A. Prevent backflow of blood. B. Pump blood to the body. C. Exchange gases with tissues. D. Produce blood cells. Rationale: valves and veins prevent the backflow of blood and help maintain the one-way flow of blood toward the heart. 22. Which blood vessels have the thinnest walls, allowing for the exchange of gases and nutrients? A. Arteries. B. Veins. C. Capillaries. D. Lymphatics. Rationale: capillaries have thin walls that allow for the exchange of gases, nutrients, and waste products between the blood and tissues. 23. What is the largest artery in the human body? A. Aorta. B. Pulmonary artery. C. Femoral artery. D. Carotid artery. Rationale: the aorta is the largest artery in the human body and carries oxygenated blood from the heart to the rest of the body. 24. Which blood vessels carry deoxygenated blood back to the heart? A. Arteries. B. Veins. C. Capillaries. D. Lymphatics. Rationale: veins carry deoxygenated blood back to the heart from the body's tissues. 25. What is the function of platelets in the blood? A. Carry oxygen. B. Clotting. C. Fight infection. D. Transport nutrients. Rationale: platelets are cell fragments in the blood that play a key role in blood clotting and preventing excessive bleeding. 26. Which blood vessels connect arterioles to venules? A. Arteries. B. Veins. C. Capillaries. D. Lymphatics. Rationale: capillaries connect arterioles to venules and facilitate the exchange of gases, nutrients, and waste products between the blood and tissues. 27. What is the medical term for high blood pressure? A. Hypotension. B. Hypertension. C. Arrhythmia. D. Bradycardia. Rationale: hypertension is the medical term for high blood pressure, which can lead to increased risk of heart disease and stroke if left untreated. 28. Which of the following is the largest vein in the human body? A. Inferior vena cava. B. Superior vena cava. C. Jugular vein. D. Renal vein. Rationale: the inferior vena cava is the largest vein in the human body, responsible for carrying deoxygenated blood from the lower body back to the heart. 29. What is the name of the condition characterized by a lack of blood flow to the heart muscle? A. Myocardial infarction. B. Angina pectoris. C. Coronary artery disease. D. Atherosclerosis. Rationale: myocardial infarction, commonly known as a heart attack, occurs when there is a lack of blood flow to a part of the heart muscle, leading to tissue damage. 30. What is the medical term for low blood pressure? A. Hypertension. B. Hypotension. C. Bradycardia. D. Tachycardia. Rationale: hypotension is the medical term for low blood pressure, which can cause symptoms such as dizziness, fainting, and fatigue. 31. Which of the following is a condition characterized by the enlargement of the heart muscle? A. Myocarditis. B. Endocarditis. C. Cardiomyopathy. D. Pericarditis. Rationale: cardiomyopathy is a condition in which the heart muscle becomes enlarged, thickened, or stiff, leading to decreased function of the heart. 32. What is the name of the medical device used to measure blood pressure? A. Stethoscope. B. Sphygmomanometer. C. Electrocardiogram. D. Spirometer. Rationale: a sphygmomanometer is a medical device used to measure blood pressure by applying and releasing pressure to the brachial artery in the arm. 33. What is the name of the condition characterized by an irregular heartbeat? A. Arrhythmia. B. Bradycardia. C. Tachycardia. D. Palpitation. Rationale: arrhythmia is a condition characterized by an irregular heartbeat, which can occur as a result of various factors including heart disease, electrolyte imbalances, and medication side effects. 34. What is the name of the large artery that carries deoxygenated blood from the heart to the lungs? A. Aorta. B. Pulmonary artery. C. Coronary artery. D. Carotid artery. Rationale: the pulmonary artery carries deoxygenated blood from the heart to the lungs for oxygenation. 35. Which of the following is a condition characterized by the accumulation of fatty deposits in the arteries? A. Aneurysm. B. Thrombosis. C. Atherosclerosis. D. Embolism. Rationale: atherosclerosis is a condition characterized by the buildup of fatty deposits, cholesterol, and other substances in the arteries, leading to narrowing and hardening of the arteries. 36. What is the name of the valve located between the right atrium and right ventricle? A. Mitral valve. B. Tricuspid valve. C. Aortic valve. D. Pulmonary valve. Rationale: the tricuspid valve is located between the right atrium and right ventricle of the heart, and it prevents the backflow of blood when the ventricle contracts. 37. What is the name of the condition characterized by inflammation of the inner lining of the heart chambers and valves? A. Myocarditis. B. Endocarditis. C. Pericarditis. D. Cardiomyopathy. Rationale: endocarditis is a condition characterized by inflammation of the inner lining of the heart chambers and valves, often caused by bacterial or fungal infection. 38. What is the medical term for a blood clot that travels through the bloodstream and blocks a blood vessel? A. Thrombosis. B. Embolism. C. Aneurysm. D. Varicose veins. Rationale: an embolism is a blood clot that travels through the bloodstream and blocks a blood vessel, leading to tissue damage and potentially serious health complications. 39. What is the name of the condition characterized by the accumulation of fluid in the pericardial sac surrounding the heart? A. Myocardial infarction. B. Pericarditis. C. Cardiac tamponade. D. Aortic dissection. Rationale: cardiac tamponade is a condition characterized by the accumulation of fluid in the pericardial sac surrounding the heart, which can compress the heart and impair its function. 40. Which of the following is a condition characterized by the inflammation of the outer lining of the heart? A. Myocarditis. B. Endocarditis. C. Pericarditis. D. Cardiomyopathy. Rationale: pericarditis is a condition characterized by inflammation of the outer lining of the heart, known as the pericardium, which can cause chest pain and other symptoms.